my name is Dr. Kat Kesty. I'm a double board certified dermatologist at St. Petersburg Skin and Laser in St. Petersburg, Florida.
And hi, I'm Dr. Chelsea Kesty, and welcome back to our show.
Today, we're going to be talking about an area of the body that a lot of patients come to us asking us for help for, and that is the neck.
And why does it age you?
And what can you do about it? I see that a lot in my consults. Is that something that you see a lot too?
Yeah, for sure. I mean, people start with their face, but then as the mirror goes a little bit further out, they start looking at the neck and chest. And we live in Florida, so there's sun that gets everywhere, unfortunately.
Yeah, I see that too. And sometimes patients will, do their skincare, do their sun protection on their face, maybe even their ears, but completely forget about the neck and chest. So sometimes that does catch up with them, and it's a concern that we address. So let's talk about the three most popular things that we do in our clinic to help patients with neck rejuvenation. And those are going to be Botox or wrinkle relaxers, laser resurfacing, and using a diluted filler to help with collagen stimulation from the inside called Dilute Radiesse. Tell me about your approach to putting Botox or wrinkle relaxers in a patient's neck.
Yeah, so let's start with the problem and the anatomy of why people are aging through the neck and the muscles that attach there. So there's a platysma band that basically runs from the lower jaw all the way to the clavicles, and that's always pulling down the neck. And then when you kind of make this pit bull face like this, you can kind of see some of those bands of that platysma connecting the jaw and the clavicle. So the first thing that we're going to do is definitely go after the bulk of that muscle, which is going to be those larger bands connecting the jaw to the clavicle. But after that, really what you want to do is do some rejuvenation through those kind of tech neck bands that are kind of very prominent lines that are horizontal on mostly everyone. And that's going to look like a Nefertiti neck lift, where basically you're putting small units of Botox very superficially, kind of contouring the jaw and even starting to that angle of the mouth as well.
Do you put it in people's DAOs that goes from the corners of the mouth down to the jaw as well?
Yes, I mean, that's definitely important, but the bulk of that muscle is below the jawbone, not just above the jawbone. So this is pulling down, but why it's pulling down is the whole bulk of that muscle starts from the jawbone to the clavicle, and that's where you have to address most of that kind of downward shift.
Yeah, I see that with my patients too, especially if they come from outside people that don't do neck Botox. They've been doing the DAA Botox for months or years. And I tell them that if you look at the anatomy of that muscle, the DAO muscle that goes from here to here, it's, maybe as thick as a half piece of spaghetti. But then you look at the thickness of the platysma band, especially for people in their 50s and 60s, there's a lot more volume to treat in the neck than that little teeny DAO muscle. So, it's very popular on TikTok and Instagram to treat that DAO, but, I always have to counsel my patients. If you want that big bang for your buck, you really have to treat the platysma muscle to get that kind of long-term lower face and neck rejuvenation.
And people are always concerned about their jowl, and really that's kind of pulling down right through here. And you can actually make a pretty good improvement with just some neck Botox and lifting that area. And then obviously people are talking about kind of colloquially what that is termed the turkey neck, or kind of those two most prominent bands in the part of the medial face, and that's definitely going to be addressed from Botox as well. Now, the risk is definitely there. I mean, if you're not an experienced injector, then I definitely wouldn't do this, but somebody who really knows the anatomy and can safely inject in that kind of central face and central neck area, that's going to be important because it can affect your swallowing. I mean, there's big muscles that are much deeper, but it is safe injection for somebody who's trained to do.
Yeah, I would say that it's a big difference between injectors too, or physicians who inject it. It really depends on how much you inject, the dose, and then exactly where you're injecting. There's a lot more room for air in the neck than even in the upper face. So
yeah, I think that really covers kind of the wrinkle relaxers, and then now we can move on to our next procedure.
Yeah, lasers. How do you approach lasers in the neck?
Well, you can't be as aggressive on the neck as you can on the face, unfortunately. So it's definitely going to be sessions, more like in the 4 to 6 range. If some of my patients in consults are like, okay, I want this, and they're kind of pulling up like this, that's not going to happen with a laser. I can make some nice tightening effects. I can get rid of some sun damage, improve that skin quality. But if you're thinking about inches off that neck, it's either going to be Kybella or a neck lift or some other type of procedure that you're looking for. really to match the kind of face and neck skin quality and get rid of that sun damage and help with the rejuvenation of it. That's going to be some sessions with lasers for sure. Usually fractionated, like I said, so you can't be as intensive on the neck that you can be on the face. So some sessions with that.
Mm-hmm. I agree. A couple sessions of laser on the neck can really make a huge difference, especially when in combination with some neck Botox or wrinkle relaxers.
But again, it's definitely going to be a lot more subtle than it is going to be with a full neck lift or something like that. But it is going to be a difference in the quality of the skin that you're going to see.
Yeah, we're grateful to have really wonderful relationships with plastic surgeons that we can work on patients together, where we'll do some lasers, they'll do a neck lift or whatever needs to be done for the patient's anatomy. So we're grateful for those relationships.
All right, so Dr. Kesty, you love Dilute Radiesse in the neck.
Too.
Tell us about it.
So I love Dilute Radiesse in the neck. I like it in the chest. I like it in the elbows. I like it everywhere. I like it to fill this area. So what I do with Radiesse is I will take Radiesse calcium hydroxyapatite and I will dilute it with a little bit of lidocaine with epinephrine and some saline. And what I'll do is I will basically put it like a layer onto the whole neck. And I insert it by 1 or 2 cannulas depending on the patient. So all I do is numb it up with a little bit of lidocaine with epinephrine. The procedure is completely painless after that initial kind of bee sting injection, which is very tolerable. It's a completely painless procedure where I go in and just kind of put a very thin layer of that dilute radiesse here. I'll do it once, I'll do it again if the patient needs it in about 8 to 12 weeks. So 1 to 2 sessions, and they build so much collagen over 12 to 18 months after that procedure. And I like to think of it as adding to building collagen from the outside with lasers. I'm kind of stimulating a big amount of collagen from the inside with the Dilute Radiesse. Another thing that I like about it is that sometimes these tech neck bands are very deep, especially if the patient comes to me in their kind of 50s or 60s and hasn't had them treated. And sometimes what I find is when I'm doing the Dilute Radiesse and putting it under there with my cannula, I'm breaking some of those deep fascial tethers on those bands, and they will release very, very well with 1 or 2 Dilute Radiesse sessions. So a lot of great results for a practically painless procedure for patients. So I love that.
Is the dilution really just to make it safer, to less complications? What's the reasoning behind that?
Yes, definitely to make it safer. The complication rate with Dilute Radiesse is very, very low. You're not super worried about causing an occlusion like you would be in other areas of the body because it's so diluted with the lidocaine and epinephrine. I would say the main complication would be a small nodule, which you can either put a little bit of saline in or have the patient massage out. Obviously, I see my patients in follow-up, so we're kind of catching any of that if that does happen. When I think of Dilute Radiesse, it's not that I'm adding volume like I would if I was putting Radiesse in the jawline or the cheeks. I'd be adding, 1 cc's of volume per syringe of Radiesse. I'm not adding volume to patients' faces. What I'm doing is I'm using the hypercollagen building properties of the calcium hydroxyapatite, which is, why we love it in the face because it improves skin quality over where you put it. I'm kind of taking that and adding it to a larger surface area just to get those collagen effects.
So that's the category of filler that's like a biostimulator. So it's using your own biology basically after we put that dilute filler in, or any filler of kind of vein is basically going to make your body make the collagen in that area that we put it. So that's a nice application of that. Awesome. Well, I think those are our strategies for neck rejuvenation. And if you have any other questions, please reach out and let us know and we'd be happy to answer them.
Yeah. Thank you for watching.